When insurance companies want to get rid of you, they will call every doctor's request experimental. Insurance companies have our lives in their own hands. Look out, everyone. Make a wise decision. This is for our president also. Make a wise decision, please. Look at HR 676. Give the American people a chance to live. Our daughter, Natalie, will not come back. But I know I'm going to make a change in this world. I'm going to fly on her wings from state to state, from country to country, to talk about healthcare, to be on every American side, to save a life. And I'm going to do it. Let me give you a little brief background about my daughter, Natalie. At 17, she was very active with the Armenian Youth Federation. Eventually, she was going to go to ANC, Armenian National Committee. But guess what? The insurance company took that dream away from her. She was going to be a fashion designer. She was going to fit up to fashion school. Guess what? That dream was gone. It was taken away from her, from my 17-year-old daughter. One last thing I want to say is, don't let our story become your story. Let's make a change in this country. My parents brought me to this country to a better life. Insurance companies can't decide who's gonna live and who's gonna die. And Arnold and I'll be back. Wherever you are right now, I'll be back. Thank you. And make it a great week. Thank you. Yeah.
All right, just a moment of silence for Natalie and the other victims of the health insurance industry. All right, thank you very much. I don't know how they sleep at night. All right, our next speaker from the faith community. He is Associate Dean of Religious Life at USC. He's speaking on behalf of California Church Impact. Please welcome Reverend Jim Burklow.
Welcome, Jim. Jesus practiced universal health care. He offered healing to every ailing person that he met. Every one of them. Even if, and especially if, they had pre-existing conditions. He didn't deny health care to anybody that he met. But there are people inside this building today who have denied people health care. Let me ask those people in that room who represent the insurance industry of this country. Whom would Jesus deny health insurance? Whom would Jesus deny health insurance? Whom would Jesus deny health insurance? And if you want to wear a button that says that, I got one for you. And more. There they go. Right behind you. Spread them around. Whom would Jesus deny health insurance? I asked the people in that building. And yet, in this country, we have had a belief system over the years that it's wrong for the government to provide health insurance. Let me ask you, I want to see a show of hands out here. How many people here are really eager for the government to make your shoes? Come on, where's some hands? Nobody? Anybody here? Yes, sir.
Jesus wouldn't deny health care.
He wouldn't deny health care either. Amen on that. Much less insurance. So, we're not here to fight for the government to make us our clothes. How many here want the government to be in charge of making our films that we watch? No! Okay, but how many people here think that it's a better idea to have public sewers than private outhouses? How many people here think it's a better idea to have a public road system than to have a toll booth every block? How many people here think it's a good idea to pay taxes so we have public schools? Yes! Sure, you can go to a private school too if you want, but at least we have something to fall back on that we all can trust. Choice. We are here to support single-payer, public, universal health care. We're here to do what Jesus told his followers to do, and we're here as people of Christian religion, of people of other religions, of no religion at all, united to do what Jesus told us to do, and to do what our consciences tell us to do, and that's to provide health care for everybody. The people in there, they want a cash IV for a sick healthcare system. Do we want to give them a cash IV? Do we want them to be able to force us to pay for this expensive product, this inadequate, broken, sick product? Do we want that? No. Jesus sent me here. He sent other people of faith here, of all the different faiths of the world. We've been sent by our consciences. We've been sent by our religious leaders to come here and stand up for healing. Jesus told his disciples to do two things, just two things: preach the gospel and heal the sick. Well, guess what? Guess what? Can you hear the gospel if you're sick? It's hard. It's hard. But if somebody heals you, that is the good news. Yes? And so we're here to put out some good news. There is a cure. There is a cure, and it's called HR 676. And we're here to support it. You know, the money changers who run our deformed healthcare system in this country are in there. They're proposing further deform of our healthcare system. Do we want deform? No! Or do we want reform? Reform! Yes, we want real reform. The money changers who created this mess are in there. They're at the table. They're at the table inside. We're outside. But you know what? We need to do what Jesus did and turn the tables of the money changers and stand up for real reform. HR 676. Amen.
And I represent the American Medical Student Association.
Welcome, Parker!
That is 67,000 members across this nation who staunchly support HR 676. And just this past week, incidentally, I was informed by Sarah Rogers that she received the endorsement for SB 810 from all 67,000 member representatives. I also represent a newer group, and that's called the California Student Health Professional Alliance for Universal Health Care. Let me give you a bit of history about that. Exactly 4 years ago, with the introduction of then SB 840, at an AMSA National Conference, I was one of 3 students who met. One was from UCLA, I'm from University of California, Irvine, and the other was from UCSF, and we said, gee, we haven't been taught about this issue in our medical school curriculum. Should we do something about this? And we decided to hold our own lobby day in Sacramento. And in 2006, we thought, gosh, maybe we'll be the only 3 people standing there in the rain on the steps. And we had 100 medical students. And in 2007, we had more. In 2008, we had more. And this January in 2009, we had over 400, not just medical students, but health professional students. We have students from from all but one medical school in the state, and now we have nursing students, public health students. We are a broad-based coalition of health professional students. Our motto is, we are the future of healthcare, and we are for single payer.